Good morning, everyone. Thank you for joining us today as we celebrate and recognize UNICEF's World Children's Day, which will be celebrated on the 20th of November, which is an annual day of action for children. And this year marks the 30th year of the Convention of the Rights of the Child, which means 30 years of child rights that have helped transform children's lives around the world. The principles in the convention include, but are not limited to, non-discrimination, the best interest of the child as the primary consideration in all actions concerning the children, and the state's obligation to ensure the safety and development of our children. And it gives me great pleasure in recognition of this milestone to share with you the many actions the Ministry of Health has been engaged in and the steps we will be taking to ensure that the rights, safety, health, and development of our children is being secured. Our children are some of the most vulnerable persons in our community. The early years of a child's life and the experience that they have are critical to their emotional, mental, physical development and their well-being. Department of Health professionals are dedicated in ensuring that infants and toddlers are cared for in environments where that they can reach their developmental milestones and make progress in life skills. When our young children thrive, our society thrives. The persons providing care to our children in care settings, child care settings, both daycare centers and in the homes, are key to supporting our children's growth. These dedicated professionals spend anywhere between 8 and 10 hours a day and 50 hours a year caring for our children. They are extremely important to the future development of our children and Bermuda. That is why the Department of Health has made this sector a priority and enhanced its program to oversee and promote quality and best standards in daycare settings. The program has enhanced its capacity to provide the support, education, and oversight that these settings and our children deserve and need. With a combined background in early childhood education, social work, and daycare experiences, the team are well positioned to provide support to the learning environment while also ensuring compliance with our laws. The program has increased visits to all child care settings and placed a focus on the curriculum and the development of our children and not just on health and safety. And this approach is based on best practice in different jurisdictions and is documented on instances that have occurred locally. Now, while the majority of daycare centers and providers deliver loving, supportive care to our children, historically there have been some tragic incidents that we never want to see reported and repeated. As the ministry, we take a zero-tolerance approach when it comes to the safety of our children. However, we also need the help of our parents. You can support your child center or daycare provider to ensure and help us to ensure that all children in the daycare enjoy good quality standards. And these are some of the steps that you as parents can take. 1, make sure that your daycare center or your daycare provider is licensed or registered with the Department of Health. If the setting that you use is not compliant, please encourage them to register with us. Each daycare center receives a license, and the home-based daycare providers receive a certificate of registration. If you are unsure whether they have one, please ask for you to be shown it, because they should have it on display. Number 2, if you have concerns with your center or provider, always address them directly with them in the first instance. The vast majority of concerns are best dealt with directly. However, if your concern is not addressed, contact the child care team at the Department of Health, who will investigate care quality concerns. You are in these settings every day, so your perspective is extremely important as a parent. The child care team can be reached at 279-4900 or at childcare@gov.bm. Number 3, the ratio of the number of children to the number of staff in a center or daycare provider is critical. If a home-based daycare center has more than 3 children, then they are breaking the law. Daycare centers have ratios based on the children's ages, and the ratios are all published on our website at www.gov.bm/childcareinformationparents. Generally, younger children must be in smaller groups than older children, as younger children require more adult care. The number of children to staff is critical to their health, safety, and development. If the ratios are correct, the caregivers can attend to the unique needs of each child. Importantly, the ratios and group sizes are designed so that caregivers can respond quickly and adequately in the cases of emergency. The children to staff ratio is one of the most important aspects of quality child care in any setting. Of critical importance is also the education and support of the professionals who care for our children. That is why a key component of the program is education. We work with daycare center staff to support capacity building programs and ensure continuing professional development. We also encourage the creation of educational programs on the island. To end, I want to remind us all that early childhood education is not just about babysitting. It is a valued and respected vocation and should be seen as a future career opportunity for Bermudians. We want to raise the bar for both our children and our professional caregivers. So in recognition of 30 years of the rights of the child, I'm very proud of the significant enhancements we have seen in the child care sector, and I'm grateful to all the stakeholders for their collaboration to develop, educate, and assure the safety of all of our children. Thank you.
Any questions?
Minister, is there enough resources on the island for the need of childcare?
For the provision of childcare? Well, we have, I'll step back for a moment because I'm not sure exactly how many numbers of registered care providers that we do have. However, you know we're having a declining population and a declining birth rate. So we have, is it 22?
We have 40 daycare centers and 60 daycare providers.
Okay, so there's 40 daycare centers.
And 60, give or take, home daycare providers.
60 home daycare providers.
Does the ministry have enough staff to police it all?
I'm looking at my staff now, and they are tremendously busy, but they are more importantly tremendously committed and effective in doing the job that has to be done as outlined in the legislation.
Any additional questions?
Sorry, Minister, I'm coming in a bit late to this. Apologies if it's already been asked. I'm really just following up on the story that ran today to do with the unfortunate passing of the child that was sent over to the facility in Utah. Is there going to be any kind of independent investigation into how Child and Family Services is handling these cases?
Well, let me start by saying that the government is extremely committed to ensuring the safety and the protection of all of our vulnerable citizens, be it seniors and or our children. However, as was outlined in the newspaper today, the Ministry of Legislative Affairs, to whom the remit of Child and Family Services is within their remit, have indicated that an investigation with respect to the horrible circumstances surrounding that matter is being looked into and commenced ASAP.
Who will be doing the investigation, Minister?
I'm not in a position to say. I think it would be best directed towards the Ministry of Legislative Affairs, who, as I said, have remit for Child and Family Services, but I can say that they've indicated that a full investigation will be undertaken.
All right. Thank you very much. Concludes the press conference.